Hello, everyone, and thank you for joining us today for part 2 of the Anesthesia Bootcamp series. I'm Laura Herrera, Vice President of Marketing for Somnia Anesthesia. Today's topic is titled Monitoring and Rewarding Coverage, OR, Practice Analytics, and Pay for Performance. Joining us today is Stephen Songhurst, Director of Quality Research and Clinical Analytics, and Linda Casamo, COO of Somnia Anesthesia, who also happens to be a practicing CRNA. We will have a Q&A session at the end of the presentation where we will be able to answer all of your questions. Feel free to ask your questions during the presentation in the chat box area. All of our presentations will be available on YouTube and accessible through our social media channel. The Anesthesia Bootcamp series will be running all month long. Be sure to visit www.somniainc.com/bootcamp for a list of scheduled webinars. So now, without further ado, Stephen, take it away.
I think I'm going to take it away. Hello, everyone.
Oh, I'm sorry. Linda, take it away. Linda, take it away.
That's okay. Thank you so much, everyone, for joining. And Laura, thank you for that introduction. Today, we are going to be presenting a topic that's very near and dear to both Stephen and our hearts, because from an operations perspective, as Laura stated, I am the Chief Operating Officer for Somnia, and we rely so heavily on these analytics to be able to make really important decisions on our practice. So the first objective that we're going to be reviewing is to review the evidence-based operational analytics to maximize our OR efficiencies, because as we all know, if we're going to make any changes to the coverage models or any changes into that operational platform in our facilities, we need evidence-based metrics to be able to justify the changes. Then we're also going to review how we track and trend our performance and our utilization metrics to enhance clinician and administrator buy-in. Again, tying back to that first objective, because in order to make any of these changes, we have to have buy-in. Then the third objective will be our quality program review. We also happen to also be a PSO. Then we use our network for benchmarking, and we also use national benchmarks. And then finally, we're going to discuss how we have developed a clinician P4P program and how we have individualized clinician scorecards to be able to communicate back to our clinicians and to our hospital and ASC partners. Stephen?
Thank you, Linda. So the first slide that we're going to review today, we've titled it Anesthesia Staff Evaluation and Development. More importantly, and primarily, this supports our ongoing professional practice evaluations, but really it serves as a individualized clinician scorecard. I'm sure, like most of you, we have data from multiple sources. We have scheduling data, we have billing data, maybe you have some patient satisfaction data, your quality data. So we use a proprietary BI tool as a way to make all of this come under one roof and report it back to the clinicians. Now, we do this at a minimum of every 6 months, which is, of course, ahead of schedule for the Joint Commission requirements in terms of how frequently we need to do this. But we also offer this ad hoc, either at a clinician request, the medical staff office request, a medical director request, you name it. And as you can see on the slide, it combines basically your build minutes, looking at your anesthesia start and stop times to show productivity and efficiency against how many hours or minutes that clinician is scheduled for over a period of time. That's what you're looking at in the top left. And then on the right, we break it down in percentages just for easier interpretive purposes. We also break down each clinician's case volume. We'll show it by their anesthesia method as well as their ASA classification to get a better understanding of the acuity of the patient populations they are treating. We'll break down their surgical and their OB patient satisfaction, which we'll dive into in a little bit more detail later on in the slide deck. And then we also have their detailed adverse events. This way we can, of course, see the patient safety that is tied to all of this. And again, all copies are always provided to the medical directors and to the medical staff office.
And these are reports that we use because we have all different types of practice settings throughout our network, anywhere from independent CRNA practice to all physician practice and an anesthesia care team. So we can use this, and we watch this very closely in order to ensure clinical excellence.
So next, we're going to take a look at some examples of utilization. So as I showed you before in the previous slide in the top left, right, we have maybe different service lines. Maybe it's OR and cardiac combined like we're looking at now. Maybe it's just for your endoscopy coverage. Maybe it's just for your IR or your cath lab. But we're always set to cover a certain number of rooms or for a certain duration of time. And so what we do is we break down, for instance, in this example, we're looking at a period of 7 a.m. to 3 p.m. And what you're looking at here in the y-axis is your total hours of coverage. And then the blue section represents of that total coverage, how active were we in the OR looking at those anesthesia start and stop times. So really at a high level, what we're doing is we're providing these to the sites as frequently as we can to ensure that folks are able to use this data to make those actionable decisions and ensure that when we need more coverage because case volume is flexing up, that we're there to staff it. Or maybe if things are trending down, you have surgeons taking time off or what have you, we're able to adjust on the fly as needed.
You know, and the other thing too that I would like to add, Stephen, on this is that we really watch it too for clinician burnout, because if we see that this utilization is trending up to 65, 70%, this utilization does not include turnover time. So, you know, if we've got a 65, 70% utilization, you put turnover time in that, you know, you're easily getting up to 75, 80%. So we do watch this very closely, not only to see if we could par down rooms, but also if it's getting too busy and if we need to adjust that model.
Great addition, Linda. Thank you. So this next slide, we're looking at a customized utilization dashboard. So this is kind of a more robust and specific example of the aforementioned slide. So we'll be looking at, for instance, right here, you know, we're looking at an entire year's worth of data, but you can see that we have filters for individual day of week, for a specific month, maybe the entire year, a specific service line. And this tool actually allows the medical directors and administration to go through and make certain selections so they can actually better understand the efficiency, again, by a day of week or by a service line. It's just that added layer of really being able to be precise to make sure that you're effectively managing the caseload, you know, for your clinicians and for your patients. Next, we have a rooms running graph. So taking the same sort of data, looking at all the billing data, your start and stop times. If you look here on the y-axis, this is representing the total number of rooms. And then on the horizontal axis here, this is broken down by hour of the day. And then each of these bars represents a day of week. And then of course, the line is your weekday average. So really what this is showing you by hour, by day of week, how active are your operating rooms, right? And you can see that maybe, for instance, at 7 a.m., maybe you get off to a slower start in some cases, but then all of a sudden, you know, between 8 a.m. and the lunch hours, you're really active. And then of course, as the day winds down, maybe you have providers that only work, you know, 7-8 hour shifts. So you would expect that case volume to go down, but this is just a layer that should really tell the same story as the utilization, but just another way to look at your productivity and the activity right within those ORs, you know, by hour, by day of week.
If I could just add, this is a very simple graph that we use a lot, especially from 3 p.m. and after, to make sure that we're running enough rooms after that 3 p.m. mark. We use this quite frequently, and we can adjust up or down.
Well said. And this is really the same data, but another way to look at it. So this blue area here follows the same trajectory that the previous slide followed. But now what we've done is we've put it up against really red. Really means that you know, these are people or these are rooms that we're staffing, right? But the rooms aren't as active. So for instance, you know, at 2 p.m., you know, it looks like we're averaging in this model about 4 rooms, but we still have 8 rooms open. So to Linda's point, we will use this data and these graphs to be able to flex that coverage. Maybe it can be a little tight in areas, and we know that we need to enhance capacity. So we'll add a couple of providers or open a couple of rooms, and then sometimes we'll do the opposite of that. Next, we're going to look at productivity. So this is just one of the many ways that we will break down your OR case volume. So you can see here, we've broken it down by month, and then we've had a stacked column where we'll put the main OR, the endo, cardiac, neuro, which is your non-operating room anesthesia, and then your OB totals. And of course, this is customized to every site with respect to the kinds of cases they do, but just another way for us to look at the overall case volume by month and see how things are trending up and down. What we also do is we take that same data and then we'll break it down by the day of week, just like we do for the utilization. Again, it's always going to tell the same story, but it's just another way of looking at it to see how some days are maybe more active than others. In certain cases, depending upon the construct that you work in, maybe you would expect to see the same thing day after day. But, again, if you have certain suites or areas that are going to be open on some days and not others, you want to make sure that these graphs tell that same story. Next, we also have cases broken down by surgeon. Now, of course, for the purposes of this presentation, this is all de-identified, but just going into the added layer that we always want to show the overall cases by individual surgeon over time. Of course, in anesthesia, right, we work really closely with these providers, and especially when you're considering things like surgeon satisfaction and your patient satisfaction, the scorecards we saw before, all of this to some degree ties to that. And so we like to know who we're working with most frequently. We also dive into the case cancellation. So there's a few different graphs here. On the top, you'll see an example where we break down all of the total case cancellations, but then really more importantly, your same day cancellations. We will also break it down by individual specialty when that data is available. Of course, again, this is always going to be customized to the site and what we have access to and what their interests are. And then, of course, you can see here the cancellation by reason, which is kind of always my personal favorite, right? Because there might be some things in here that, that we can control. Maybe it's things related to clearance issues. Maybe it's your medical complications or something related to your labs. Of course, if it's something like the weather, we know that that's somewhat out of our hands, but we always like to work with all of our clients and with the groups to make sure that we are, doing our best to reduce those cancellations and more specifically, those same day cancellations. Another breakdown here is your first case delays. Now, again, this is always customized. It depends on how they're going to be categorized by the site. And the other thing I'll add here as well, some of these, higher groupings could even be broken down into more subgroupings from time to time. But just another way to see, right, when we're kicking off the day, if there are case delays, why are there case delays? Is it an anesthesia related issue? Is it something related to their H&P? Is it because the surgeon is later unavailable, right? But it's just another added layer to try to optimize that efficiency wherever we can. Next, we're going to talk about the quality program that we have, which is a really robust program that I know Linda and I are super proud of. So we have an outcomes form, which is just a quick snapshot over to the right of what you're looking at. But it's a way for us for every single case to capture data related to the urgency of the case, your ASA classification and anesthesia methods, comorbid conditions, the kind of procedure, your macro MIPS, and then any adverse events that could be related to that case. And ultimately, we'll have a couple of graphs that result from those forms on a monthly basis. This is just a quick example of compliance. All of our sites, we do a really great job of implementation and tracking these for every case. We want to make sure if we have 200 cases in a week, that we, of course, have 200 forms. So we obviously want to track and make sure that we have the form and that all the data is complete and accurate. And then ultimately what it leads to is a graph like you're seeing here, where in this case, the blue represents an individual site and the red will represent the benchmark that Linda alluded to in the objectives. And of course, this is going to be both internal and external benchmarks, but it just always gives you an example of your adverse event rate compared to your peers. And of course, this is customizable as well. If you're a trauma center and you want to just be compared to trauma sites, there's a way for us to do that. And then more importantly, and this is my personal favorite, this is the detailed adverse event breakdown. So of course, please know that all of these MRNs, are fake here. They're de-identified. But this just goes to show you the robustness behind these forms. So for every single case that's completed when we have a form and there is an event, We'll see the MRN, the date of service, the age, the gender, the ASA classification of the patient, any of their comorbid conditions, the kind of procedure it was, the kind of anesthesia, or the kind of case it was, excuse me, the kind of anesthesia that was administered, who the provider is, and then what that detailed event is. And as Linda alluded to in the objectives, we have a patient safety organization. So all of this information is protected and housed under that PSO. In addition, we do collect patient satisfaction information. Now, this is just a very quick snapshot. Our patient satisfaction survey actually contains 11 survey items. This is just a snapshot of 4 on the following survey piece of this. This is a white labeled product that we worked with accreditations, companies in accreditation to create. And these are administered monthly for all of our patients. And you can kind of see how it's broken down and how we track and trend this year over year on the top graph. I think one important thing to note here is that a lot of the other patient satisfaction surveys that may be out there, specifically, for instance, for CAPS, there aren't many targeted anesthesia questions. And that was the purpose behind us creating this white label product, to really be able to get that information so we can enhance that patient experience process. And then on the bottom graph, you'll see here, this is just the Likert scale breakdown. So when we do see that maybe a score went down somewhere, well, was it that the patient, just wasn't very satisfied? Maybe they were somewhat satisfied. It's just an additional way to break it down so we have something to act on. And then we'll also break it down by individual provider. And again, this is kind of an example of what feeds into our ongoing professional practice evaluations, that initial scorecard that we looked at when we first started this presentation. And then lastly, we have an overview of the Pay for Performance program. Now, this is a really robust program, and really what we're trying to do here is, with all the clients that we work with, we're trying to take the goals and values and objectives of the site, and we're trying to align that with the clinician behavior and performance. So there are 3 core arms to this program. We have core metrics, or the quality, where we're going to be looking at things like patient and surgeon satisfaction, some of your macro MIPS reporting, all of your compliance audits. We also have an educational or professional development arm of the program, where we're of course going to be enticing our clinicians to participate in things like the IHI patient safety courses, maybe team steps and HRO training, other things of that nature. And then we also have an acute pain program, which is really for your skill acquisition and maintenance. So of course, we're going to be helping to train providers and holding didactic workshops to do trainings for certain blocks. And then of course, the maintenance piece is making sure that they're keeping up with those, and that when they do perform those blocks, that things like documentation are always up to par. And then we use the same proprietary BI tool that we use to support that first scorecard we showed you, to create some clinician scorecards here, where all of that information we just went over, the core metrics, the education, the skill maintenance and acquisition, is all available in one screenshot. And of course, these are shared with individual clinicians that have this as part of their contracts and in their program. And then of course, we have a whole Pay for Performance committee that reviews these on a quarterly basis, to make sure that, of course, we're getting the value and that we're upholding patient safety and quality wherever we can. And with that concludes the slide deck. So Laura, I will turn it back over to you.
Thank you, Stephen and Linda. So I don't have any questions right now. If anybody has any questions, please send them over in the chat box right now. In the meantime, I'll let you all know that the recording will be available sometime next week. Please check out our social media channels. We will be posting it on there. It'll be available through YouTube as well. We appreciate everyone coming out and listening to our webinar. We hope it was informative. If you have any questions, please don't hesitate to contact us at Somnia. But Linda, Stephen, it doesn't look like we have any questions today.
Okay, well, that's great. Thank you so much for joining us.
Thank you, everybody. Have a great day.
Thank you for your time.
Bye-bye.